one of the we'll never forget this. One of the interventions that again you have to go to the community, meet the people where they're at. We would literally I would shadow the kind of like the manager of the clinical work program. She would give sex education and STI and HIV prevention classes in strip clubs, like in actual clubs, with the pimps there, with the female or whatever gender workers, with the men that solicited these services. She would come in with a presentation, and it would just right there, right, brilliant, brilliant. Meet them where they're at. And after that, I was like, oh, I'm sold. This is exactly what I want to do. Um, and I shadowed the clinicians that were there, right? And went into to different families. At that point, there were a bunch of research projects and research students from Colombia, because just as Partners in Health has Harvard, Clínica de Familia had Columbia University. So a lot of their students would go there and do research and all those things. And so I worked on a couple of research projects. I did a...
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all.
Welcome to Public Health Careers. In today's episode, you'll hear more about 1, building a professional life intentionally as a first-generation university student and the challenges that come with that. 2, imposter syndrome and mental health challenges, and how this guest worked through that and continues to work through it to overcome this as a public health practitioner and just generally in life. And then 3, being a practitioner that shows up and shares and advocates for the voiceless to ensure that they are being heard, whether that's in a community group or in a professional setting. Thank you so much for listening. Be sure to subscribe, leave a 5-star review, and share this with someone that will get some value with it. That really helps the show get out to more people and helps us grow. That is one of the greatest things that you can do, is leave a 5-star review and or share it with someone. So appreciate that. And if you would like to support, there is a link below where you can support as a one-time contributor or as a monthly contributor. So consider that. Thank you all so much and enjoy the episode.
Hi, everyone. My name is Darian Leta. I am a public health warrior, and you're listening to Public Health Careers. Thank you for having me, Omari.
Today, we have Afro-Dominican and Puerto Rican community health advocate committed to providing the best care to the most vulnerable populations of this world. She conferred a bachelor's in biology at Elmira College before working a few years and then getting a master's of public health at Boston University School of Public Health. She currently works as a senior manager, substance use and recovery initiatives. We have Darian Leta, MPH. Welcome to the show.
Thank you so much for having me.
It is my pleasure. I know we connected online maybe a couple of months back now, and I think it's just always awesome to hear new stories and new perspectives, and I know you're doing cool stuff out there.
Yeah, thank you so much. I'm excited to be here.
My pleasure. So how do you identify, how do you identify?
Yeah, so I am Afro-Latina, Afro-Caribbean, African ancestry. My immediate ancestors are from Puerto Rico and the Dominican Republic. I was born and raised in Boston, and I love my city, and I'm just excited to be working here and doing the work that needs to be done.
Awesome. Well, thank you for sharing that. And definitely is important, I think, to identify just our identity and who we identify as, especially in public health. We realize just how important that is to supporting communities in getting the health and all the different resources that they need. And I know in your intro you said a little bit about centering equity in substance use and recovery initiatives, and that's what you're working right now. So I'd like to ask you to just chat a little bit more about centering equity in substance use and recovery initiatives.
Yeah, let me also just say, I forgot to mention that I use she, her, pronouns, but it relates to your question really, because before I would just identify with female pronouns or she, her, hers, but as being a descendant of ancestors that come from the Caribbean, since anti-Blackness is very prevalent in the Latinx community. And with that, folks don't know that I have, that I speak Spanish or that I come from these specific countries. And so I make it a priority of mine to say that my pronouns are she, her, ella, so that folks can relate to me and connect with me on a deeper level. So I'll just start there with the equity, because I think that's important. I think when I come into the work, when I come into all the rooms that I'm so fortunate to be in, and I also fought to be in, it's important to share your stories, share the stories of the people that you interacted with, either clients, community members, previous coworkers, into those rooms when you're providing equity, because without that, without differences, without different perspectives, without people coming from different parts of the world, we wouldn't have the community that we have now. And I feel like that's where equity starts with and ends with, just having us all be in one place safely, right? And being able to live to the fullest. And that also is part of the work of making sure that that's possible, right? So that's also equity, health equity in that instance. And, whether it is community health, I feel like there's so many different terms now: community health, public health, health equity. It kind of should all encompass everything. And unfortunately, it has just taken society a long time to relate the two: health equity, community, and public health, medicine. And that's what I'm working on currently.
Yeah, I love that. And I love the part of talking about just being a voice for the voiceless, or just showing up in these rooms and understanding that there are so many people that don't get this opportunity or aren't able to share their experiences. And yes, we want to work to get them a voice for themselves, but at this point in time, we have to use where we are and who we are to share that. And I think diving a little deeper into that was the point of view, making sure that you say she, her, ella. Because to that point, there's representation, and then there's just you identifying as that, and what you are bringing into the room, people knowing that. So I appreciate you sharing that. And in that vein, what does public health mean to you? Yo, are you looking for an online community to connect with like-minded health-focused people? Join my free community health and wellness Discord server at thephmillennial.com/join. You'll find growth-focused people talking about important community and personal health topics, networking opportunities, online yoga, book clubs, and more. Be sure to introduce yourself when you join. Link is in the description. Now really, back to the show.
Yeah, that's the question of the century, huh? It's so funny. I knew that was the first question you were going to ask, and I was like, let me look up the actual definition, and then I was like, no, I have mine. We all have our own definition, and I kind of just said it, right? Public health to me is a world where no matter where you come from, you are able to live you are able to live your life without the barriers, without certain barriers, to the fullest, right? So everybody is well, everybody is, for folks that are breathing and having transition, we're alive, we're in this world, on this earth, but we are not living to our full potential because we have so many barriers to fight or challenges to overcome. And I feel like with public health, the work of public health makes it so that, we should be working to break down those barriers so that everyone can live their full life, their full potential. However that may be, different folks might have different, lives that they want to live. And since public health is everything, public health is, the transportation that you might not have to go to your local medical site for your appointment. Public health could be, the fact that your community lives in a food desert, right? And I just heard the other day, food swamp, right? So like, and just looking at all these different terms, but in reality, it's just that society has not prioritized certain neighborhoods to have healthy, affordable, nutritional food items for certain communities, right? So how do we make it so that's possible for everyone? I know that's a long answer, but it answers the question.
I can absolutely tell you it wasn't the longest one that I've had. So you're fine. And like, I think it is important for you to share what that means in its full, like, and in its entirety to you, because it, as you said, it is everything. And to all of us working in public health and practicing in public health, it is so many different things. And I think, like, to your point earlier of saying like public health, community health, equity, all of them stem from the same thing, like wanting to improve the lives of people. And then, like, to your point again, like we talk about food deserts or food swamps. It's like we change words, we talk, we say different things. There are new terminologies that come into play, but at the end of the day, we are still talking about the same issues that affect the communities that we know that have been most disinvested and most oppressed upon. So definitely appreciate you sharing that and just working towards breaking down those barriers. And one of those first steps that you took to starting to break down those barriers in your path and your public health journey is getting your Bachelors of Science in Biology at Elmira College. So talk us through the thought process of that.
Yeah, so I still haven't found a better term for this, and I might not even say it because it's just a negative connotation, but I will say, so I'm a first generation. So in my immediate family, let me clarify, first one to graduate from college and first one to get a master's. And originally, and when I reflect, I don't really know why I decided to leave to go to undergrad. But I think just looking back, I would think there was no other option, or I felt like there was no other option. I'm a statistic in many ways, but definitely very early on when, small liberal arts school, target urban high schools and, fill them up with promises and I'm going to give you scholarship money, right? And so that they caught me and I went to this small liberal arts school because it was really the school that gave me the most money, right? And so I didn't want to go. I originally wanted to go to another, upstate New York school that didn't give me any money. And my family was like, no, you're going to this. They gave me a little bit. And I was like, fine. But, I came in very naive, right? So, the one that, wanted to continue my education. And, I went to high school in Randolph, Mass, which at that time was the most diverse high school in the state. And so I was just used to being around every racial demographic, every gender expression, just really very culturally fulfilled with everything that a community could offer. And then I went to this small PWI, predominantly white institution that really just treated me horribly, to be quite honest. A lot of my mental health stems from the 4 years that I did experience in that undergrad. And I knew that I just had to suck it up and finish because I didn't know. There was no point that I could not finish this for my family, for myself, for just the culture, for my ancestors. I was literally thinking these thoughts as I was really depressed in college because they just didn't treat me right. And originally, children of immigrants, you're either a doctor, a lawyer, an engineer. And originally I was like, okay, I'm a doctor because at a very young age, I knew that I wanted to help people. And I didn't know about public health. Really, back then, it was just doctor. But, then I just started realizing that I wasn't as smart as the other students that were getting A's and A minuses in their science classes. And I had to work. I had to work, and I had labs, and I had class. And so that really limited me from a lot of opportunities that I could have had, and a lot of study time to, make me think that I could get into med school. And so by the time I graduated, there was just no way that I was going to study for the GRE, because I knew that they would just throw my application in the trash at that time. And, when I applied for an internship for Partners in Health, so my first love was public health. My second love was public health. My first love was reading. My second love was public health, but specifically global health. And back then, the only place that I knew of was Partners in Health, which is actually based in Boston, started by Paul Farmer, Ophelia Dahl, and a couple of other individuals. That is just a nonprofit organization that offers public health services really to a lot of countries around the globe. And when I didn't get the internship, and they just said, "Hey, do you want to just be an off?" You didn't get the internship because you didn't have a international experience. And I was like, well, yeah, because I'm a poor kid from the hood, but and then they said, but do you still want to just volunteer? And I was like, yes. Right. And that was the first time that I was in a place that actually knew, and it was in a place that really understood what I wanted to do. That's when I really started knowing about public health, global health. It's not just being a doctor. It's not just being a nurse. And so, yeah, after those 4 years of trudging through that undergrad, I finally got out and was able to tiptoe into the world of public health with that first internship. Yeah.
Well, thank you there. And firstly, I'll push back on you saying that you're not smart. You definitely are smart. You might be smart in the things that people deem smart for medical school, but that's a whole other conversation. So just want to let you know that you are smart.
I'm just so happy because, we'll continue to ask questions and I'll tell you why.
Right. But I feel like that this is not an unsimilar story of like wanting to go into medicine because that is what your family, society tells you, like, that's successful, that's what you could do, or like to your point, you can pick these different career paths. But I think in that it is also you wanting to like do more for humanity or like help people, or maybe that's something that comes along the path. Granted, there are people who go into medical school just to make the money, but that's a whole nother conversation as well. But before, and it's funny that you say like Partners in Health is just a nonprofit. that is funny.
There are a lot of things, and I have so many connections with them, which I'll talk about with a couple of my first jobs. But yeah.
Awesome. And if anyone is interested, I watched a documentary. I think it's called Bending the Arc on Netflix. Definitely check that out. I think it's inspiring as well as like kind of just deeply understanding of public health in a like local, global landscape, whatever that means to you. Okay, so yeah.
I was gonna say, and I usually start when I forgot, but R.I.P. Paul Farmer. A couple of months ago was his 1 year anniversary of his transition, and I was devastated. But continue.
Yeah, I can imagine. He was someone that really painted a path for what health can look like, and just supported a lot of work that people thought was unimportant, and we realized just how important that is. So yeah, definitely check out that documentary. He has written books.
So many, I have all of them.
Right, I will link some of them so you can check those out as well. Okay, but I want to talk about like during your bachelor's program. So you said that you're in this biology degree, you're realizing that it's tough for you being a first generation person, having to do the school work, the actual work, the labs, and probably just live life and like try to also have fun and whatnot. And during that time, you also had a few internships. So I want you to talk like about that process, about the internships, and like what was your process going through school? Because you also said that you realized that it wouldn't make sense for you to take like the GRE or the MCAT or whatever to make that next step, because you thought it would be a waste of your time and resources. So I want to just like hear that progression, and I can name the positions, but I don't know if I should.
No. I mean, I think, again, I knew at a very young age that I just had to find everything by myself, right? It didn't take that much to, and also I'll also just start. I was also another statistic in this particular university in Elmira College because, they sucked me into the private loan system. The small liberal arts schools are in cahoots with Navient, with Sally Mae, with all these private loan, and they got me. Black women are the largest population that have private school loans, right? So, they caught me. My mom had bad credit. I wasn't even in the room when they signed my life away, to be quite honest, right? Again, being a child, and we know that we get every summer you are going to the islands probably. And my dad lived in DR at that time too. And every summer I would go. So of course, naturally the summer when freshmen had to complete their mathematics assessment, which is what you kind of do as a freshman for some colleges. I didn't. I was in DR. And so I had to take the math assessment during orientation. So when I was doing that, the financial office was talking to my parents and signed my life away to be a victim of the private loan industry. So I knew very early on, I was like, oh, this is not a good place for me. And I just knew that nobody was really going to help me, really. My parents didn't know. Some of my family members still don't know what I do, right? So that's what I started to do. I realized there was a hospital right down the street, walking distance. So I went to their volunteer office and I made friends with them. And at first, I don't even think it's on my long resume, but I was a courier. Courier. Mm-hmm. Courier, yeah. Bilingual folks, you understand now, know how to pronounce certain things. But I would just, have my little carriage in the hospitals, bring in certain things to certain departments. And then, I became a volunteer that send messages to like providers from the volunteer office, and they love me over there. I still talk to them from time to time. But then, there was also daycare there. So I just walked into the daycare and said, hey, can I be a substitute teacher? So that was one of my many jobs in college. So sometimes they would call me on Tuesdays when I didn't have labs, and I would be a substitute teacher, and I still miss them kids. I have a picture of them on my wall. But then again, I was like, okay, so I need to do more. I can't just be a volunteer at a hospital. So I went to the Chemung County. So the county that I was in, that the school was in, was called Chemung County. And I was like, obviously there's a health department in every county, obviously. So I went there and I met someone that was part of the Medical Reserve Corps of Chemung County, which I didn't know. I didn't know what this was. And every state has this. Every county has a Medical Reserve Corps. So if you ever want to also look up volunteer trainings for just general citizens, they just train you to be kind of like a person that can be of a service during like emergencies, right? So if you're not trained, like you're not certified, but you're trained to, this person needs this amount of assistance. Oh no, this person just has a broken leg, and then let's do use their belt to tie the blood, right? The blood circulation, all that stuff. So there's just things out there that you will never know if you don't ask. And I'm a Leo, so I just go out and do things for myself. And that's what I did. So that was my internship. I did 2 internships there, and I worked, there was a syphilis outbreak currently when I went. So I helped some of the nurses do like certain things, small things. Again, I didn't know I was just doing whatever they told me. So that was some of the stuff that I did in college. And then again, when I graduated my last year, I applied to be that intern at Partners in Health. And so that was the year after I graduated. So I already did everything, and then I graduated and then went to Partners in Health. Yeah.
Okay, well, thank you for sharing that. And I think, firstly, I want to say, like, sorry for the predatory private loan system. That
should be a whole podcast.
Exactly. It is crazy. And like, just to think, like, a lot of people are just going into university wanting to do better for themselves, not understanding all of these things, and then they say, like, this is the way that you can fund it, and not realizing what that entails for the rest of your life, in many cases. So yeah, I'm sorry for that. And then I also appreciate you I appreciate the vulnerability in sharing that. And please reach out to Darian if that is your reality as well, because I think, like, you need to get someone that kind of understands that situation and like figure it out, because it is your life, despite the crap that is. But I like what you said. Like, you don't know what you don't know. You're first generation, and when coming into this school, and you're like, well, there's a hospital down the road. Let me see if I can work there, become a courier, volunteer, and just kind of build in those experiences. And I'm guessing that you learned a lot during that time, while also like doing the other things around school. And did you have the word for public health at this time, or did that come after you graduated and then you went to work with Partners in Health?
Yeah, so actually, I found out the word, like, specifically because at that college that I wanted to go to but didn't give me any money, it was called Ithaca College. People are more familiar with Ithaca College. And I don't know how I found this opportunity, but again, being in high school, I was like, Mom, look at this. Again, they were doing their own thing. I was the one that was like bringing these new information to my family. And so I was like, oh, look, they have this summer program, and you learn just a few things. You do a couple of classes with a bunch of high school students about, a subject. And obviously at that time, mine was going to be health. So mine was health. And the book that they had us read was Mountain Beyond Mountains, about the story of Paul Farmer and Partners in Health. So I was like, this is exactly what I want to do. But again, I didn't know anything, right? There was internet then, of course, but there was just less things. I didn't have access to all these different resources that I'm trying to mentor people right now. There's just so much out there. Back then, I would have done things very differently if I was a high school student now. I definitely wouldn't have gone to a PWI, right? So that's how I found out about public health, and then again specifically global health, right? Because he went to Haiti first and all that, and they actually had a site in Dominican Republic. A lot of folks don't know this, but they did have a site in Dominican Republic, but ultimately they shut it down. And I was like, perfect. Like I saw where I wanted to go at that time, which is why I applied to the internship.
Okay, shout out to them giving you that book and
right,
kind of your world. right. And I think like that is the interaction that people need to get earlier in life to realize that this public health thing is something that you can do, and you can do it like anywhere in the world, because there's so much opportunity to improve health from the systems that have been set up around.
And you have to prioritize that. You have to prioritize that because again, back then we did not have as many distractions as we do now. And I also try to tell my young people this too. I knew that we didn't have money like that. So they were literally gathering scraps to send me to this 2-week, 3-week, 4-week program at Ithaca College that was, back then a lot of money. I mean, just to send anyone anywhere, a lot of money. Like I hardly went to field trips, right? Like, so it was a lot. It was a lot on my mom and my stepdad. And my dad also sent money from the DR to help fund this summer program. But if that's really what you want to do, then prioritize that. Don't say, I want like sneakers, like envision what you want, right? And if you know your family circumstances, really try to prioritize and try to be very diplomatic on what you really want to do. Again, it's different now. You can get paid internships and do, right? So it's different than what I could do back then, but yeah.
Yeah, but I think that point still like is important in like intentionality and saying, okay, this is the thing I want to do. Let me align my actions and do the things that I need to do, or stop doing the things that I don't need to do that are going to prevent me from doing this one thing.
Right. You don't need another book. You don't need another Charmed series, right? Like, yeah, no.
Truth. And then, so you got your Master's of Public Health at Boston University School of Public Health. But I want to talk about like prior to that. So you graduated, you got into Partners in Health, you worked after Partners of Health, you worked as a community health researcher at Clínica de Familia La Romana, and then you worked as a community health worker for PACT at the Justice Resource Institute. So tell us about that progression, and then leading into wanting to get a Master's of Public Health at Boston University.
Yeah. So the internship at Partners in Health really, again, framed me because I'm a Leo. I'm that person that will go up to you in a party and introduce themselves. And I'm just so grateful that I'm a natural people person, a natural networker. I didn't know what that was back in the day. I just like talking to people, and I talked to every single person in that Partners in Health office. Till this day, I still talk to a couple of people, just check in. Oh my God, you got this job. Oh, you moved this, all these different things. And oh, let's catch up. And, years later, I still have them on Facebook. I still know, So those are connections that you have your whole life. And they remember me. They're like, you're that person that bombarded me in the corner when I was having lunch, right? And so I take advantage. And again, I wasn't part of the internship program. So when the interns did their specific projects, I would eavesdrop. I would be nosy. I would say, oh, I know I'm not an intern, but can I go to this session, right? And then when Paul Farmer came, baby, I was like, okay, can I be in that room? And he remembered me because I was the one I was like, and everyone was like, how are you so like that in the conference room? I was like, because I know what I want, right? So I was like, oh, Paul, can I have a picture? Paul, can you sign my shirt? Paul, can you sign my book? And like all the things, and because you have to do what you have to do. Be yourself. That's always what I try to tell people. Don't try to be anybody else, because that will hurt. That will be your downfall in the end. Just be yourself, even if you're loud, even if you're thinking 100,000 miles a minute, which is what I do, and just say things. It's okay. It's okay. But with that too, I knew I had to do something else. What was I going to do after this internship? So that's when I started learning about networking, and I just told people to start talking about me to anyone. And that's what happened in DR. So at the time, my stepmom was a hairdresser, and she was doing the hair of the secretary of one of the directors at one of the hospitals in the Dominican Republic. And I was like, exactly, just talk about me. That's it. And so through that, he connected me with Clínica de Familia La Romana, which is a little clinic and free HIV and AIDS. It was all free HIV and AIDS clinic back in the day. It's still free for all intents and purposes now, but if you can, they do ask you to pay a little bit, but it was free, completely free back then. It's still around. And every time I go to DR, I always go with a big check. So I went down, and again, I'm from there. So it was easy for me. My dad just got me an apartment right down the street from the clinic. And I was just there for a whole semester. And I did so much. Again, it was public health in action, community health in action. And that's where I learned about community health workers, besides the Mountains Beyond Mountains book, because that's their model. They didn't create it, but that's what they do for the most part in their clinics and their sites. So I visited patients' houses, see them, take their medication, which what we did was DOT, direct observed therapy. But again, I didn't know that. I just know that the community health worker that I was shadowing would go to someone's house, talk about their family. How are you feeling? Do you have food to take this medicine with? All those things. And so we would also go to the batalles, which is like the ghettos in the Dominican Republic, which a lot of Haitian folks reside in the batalles. So as you can imagine, unfortunately, in the Dominican Republic, Haitians are discriminated against, again, kind of like that whole anti-Blackness in the Latina community that I was referencing before. And we would give HIV prick tests, right? Just an intervention that would be here, free HIV testing here. You do free HIV testing there. We would go to class. I would shadow Clinica staff that went to do sex education and STD prevention at the schools, at the high schools, right? We'll never forget this. One of the interventions that, again, you have to go to the community, meet the people where they're at. We would literally, I would shadow the kind of like the manager of the clinical work program. She would give sex education and STI and HIV prevention classes in strip clubs, like in actual clubs, with the pimps there, with the female or whatever gender workers, with the men that solicited these services. She would come in with a presentation, and it would just right there, right? Brilliant. Meet them where they're at. And after that, I was like, oh, I'm sold. This is exactly what I want to do. And, I shadowed the clinicians that were there, right? And went into different families. At that point, there were a bunch of research projects and research students from Colombia, because just as Partners in Health has Harvard, Clínica de Familia had Columbia University. So a lot of their students would go there and do research and all those things. And so I worked on a couple of research projects. I did a transgender focus group. I did transcribing and translating interviews of families that took was in the research project, and taking either to their homes a box of food or a plumpy nut supplement. Plumpy nut supplement is one of the many supplements that low-income countries, I hate saying that, low-income countries, but we know what they are, used to kind of for calories for children and youth. And so looking at how, what is most nutritious for the person that has HIV, the child that has HIV. And so I also incorporated paper files to the electronic files. So I did a bunch of stuff there, which I was very grateful for, because, again, take advantage. Ask to do whatever. What do you need help with? I'm going to help you. And that's it. And then when I came back, I knew from my experience in college that I just wasn't in the right state of mind to actually be working with people. I was still, I say that I, quote unquote, hated people still, right? Because of my experience in undergrad, where I just did not like the people that I was going to school with. So naturally, what do you do when that happens? You don't want to go into your job because it'll probably be, you'll negatively affect, you'll have kind of like a negative aura with the people that you're working with. So I worked at Starbucks for a year and a half. And sooner or later, I got the inkling of going back to work with, what I wanted to do. And yep, I'm super fortunate that my first paid public health job was as a community health worker for HIV positive individuals at Justice Resource Institute Health for the PACT program, providing access, care, and treatment. And again, connecting back to Partners in Health, this was actually the domestic version of Partners in Health, which I don't think a lot of folks know, that there was actually community health workers paid by Partners in Health to work in the U.S. But after they switched gears and started building their hospital and medical facility and medical school, I think in Haiti, yes, they kind of cut that program from the States, and GRI picked up PACT. And that, man, I couldn't have asked for the better program. I had like 3 other community health workers that have been doing this work for years. They showed me the ropes, had a clinical supervisor. Highly, highly suggest, if you're a field worker, a patient-facing worker, to advocate for a clinical supervisor. It's like a work therapist. I mean, it's amazing, especially if you're working with patients and kind of being traumatized and triggered all the time with the patient stories. Highly suggest that. And it was just great. I mean, even back to my supervisor was, a white lady. And, I say that I just didn't trust really anyone white, to be honest, at that time. And, it kind of really changed when I started working there. And she had gotten an MSW, I think, dual from BU. And she was like, hey, BU has the master's program, and I think you don't have to take the GRE. And I was like, what? So again, back in the day, it was hush hush for schools to be like, hey, you don't have to take the GRE to come into this program. And that was true for that instance. They had a specific program where if you already worked in the field for a certain amount of hours, you didn't have to take the GRE. And so I called, and I will never forget him, Jonathan Cote, C-O-T-E. He doesn't work there any longer, but he was the admissions person that helped me. And he was like, you're the exact person that we want here. And that's what I did. I applied. Again, my imposter syndrome, I hadn't dealt with a lot of my mental health at that time, and I was still kind of finding myself at that time. So he really gave me hope, and I applied, and, so hesitant and having all those negative thoughts in my head that there's no way, right? My imposter syndrome was through the roof back then. And yep, I applied and was going to submit that last day. The last day was due, and they wouldn't let me submit. So the SOFA, which is the kind of like the website where you have to submit all your grad school stuff, it would not let me submit. I don't know why. And so I called them, and Omari, didn't you know that the day that I was supposed to submit it, they said, oh, we're in a full day retreat. Nobody can answer the phone right now. And I was like, okay. So then to me, that was like, okay, that's meant to be. I'm never going to amount to anything better than this. This is a sign that this is not for me. So of course I completely forgot about that. A couple months went by, and I got a red envelope in the mail that was kind of thick. And I was like, what is this? I opened it, and I got in. I got into the BU School of Public Health, and tell me why this man, again, I'll never forget him, Jonathan Cote, this white man was so upset that they did this to me. He pretty much called them and rashed on them, like cussed them out, like, how you do this to the student, all this stuff. And so they submitted my incomplete application that I didn't even have to pay for to him. And he ended up giving me, not only accepting me, but giving me a scholarship. So I was like, oh my God, Jonathan, thank you so much. Again, I cried to him. I was still working at Starbucks at this time. So I went in to personally thank him. I came in with like my leftover Starbucks sandwiches, breakfast sandwiches. I was like, here, thank you. This is a thank you. Give all these breakfast sandwiches to your staff. And that's how I got into the BU School of Public Health. I was so happy. Again, nobody had ever done that for me. He was my sponsor. The difference between a mentor and a sponsor, he was my sponsor, right? My boss back then that even gave me that opportunity, or that told me about it, she was my sponsor, not just a mentor, but someone that's actually helping you get to the next level. We'll never forget that. So that's how I got into BU School of Public Health.
Awesome. And there's a lot there, from you being in Partners in Health and volunteering, but also making sure that you were doing all you can to build networks to better understand the work, to corner people in the lunchroom and have conversations with them, because you never know what can come out of those conversations, as well as you putting your foot in the door and making sure that you could be part of some of the things that the interns were learning and being a part of, so that could holistically fulfill you as a person. Awesome again for you to get that networking. Well, from your, I think you said your aunt or someone was grading someone's. You never know who's going to be able to help you out, but like getting in that position and then being able to be on the ground and do that work and in this different setting from where you were before, I think is also something that's credit to you, and you probably learned a lot of that. And I think like it goes back to talking about health and culture are so intertwined, and health and what that looks like and what's important to people around their health is so different in different communities that we go to, whether that's Dominican Republic or Puerto Rico or Haiti or Boston. And I think that's also cool. And then shout out to Jonathan. That is huge. And I think we need more people like Jonathan out there who is doing his most to ensure that people who have not been given a chance or are being overlooked for stupid reasons are given those opportunities to really shine. And like as you said, not only like just being that mentor, but being that sponsor for you to help support you in that growth of you in this work, which is awesome. And as well as the boss before, who was saying like, hey, I'm MSW, Boston has this cool program around public health, you should do this. And like just speaking that into you, especially as you're saying that you were having a lot of like mental health challenges and difficulty being around people. Like shout out to those people in your lives. And I hope that we are able to both replicate that for people coming behind us and be those people for them. But I hope that other people are just out there sharing that good vibes and helping everyone get to where they can get to in this life.
Definitely.
Yes. Okay, so getting into your Masters of Public Health at Boston University, after you got in, what was your thought process in like, what am I doing here? Like this public health thing, I just did this work back in the Dominican Republic. I came back and did this HIV work with Justice Resource Institute. Now I'm in this MPH program. So tell us about that.
Yeah. So I got the job, or I got in, and then that's also when the opioid epidemic was really like it was announced, like it was prickling up, but it was really big back then. And of course, we know with the war on drugs back in the day, they would just put us Black, Latina, and non-white individuals in jail, right? Prison industrial complex. But now, because it's hitting the white community, it was an opioid crisis, and a lot of things had to change. So I was directly affected by that, because a lot of the HIV funding went into substance use and opioid response. So that meant that JRI PACT program got less funding that fiscal year. And so that was also around the time that I had lost my grandmother, my maternal grandmother, which was obviously a big shock to me. And again, I had the staff and that at JRI really helped me through it, because I could not handle a lot of changes at once. Because when they told us that a community health worker had to get cut from the program, I obviously was going to be like, duh, it's going to be me. I'm not going to have individuals that are older, that have been working in this place for a longer time, be cut from this program. So I'm obviously going to leave. Duh. That was my thinking. And so they helped me through that. And I again, I'm still in communication with a couple of the community health workers till this day in that organization. I try to bring them with me everywhere I go too. And so I just had to find another job. So again, networking, I went to a community health worker conference that they had at the BU School of Public Health. And I actually met up with one of the health workers from JRI that was still employed. And she introduced me to a previous community health worker that had to get let go of when it transitioned to the JRI previously. And she was like, hey, I just joined this Boston Medical Center community health worker program, and they needed another community health worker. Bam. Right? So if I wouldn't have never networked, I wouldn't have found my next job at the BMC emergency department as a community health worker. So Omar, I kid you not, I got that job that day because the community health worker called her boss and was like, hey, I have a community health worker. Here she is. So I talked to the nurse manager then, and she was like, okay, can you start like next week? Can you start like in 10 days? And I was like, bet. So I started. So there I was the community health advocate, community health worker at Boston Medical Center's emergency department. And if you can recall, that was also the time that the ACO was passed, and we learned that what we knew before, but now it was big news, that a lot of the money was coming from emergency departments. And since the community health workers was already a best practice, I was a community health worker for individuals that had more than 4 emergency department visits in 6 months. So every time somebody came into the emergency department that was, over the 4 time amount in 6 months, we would get a ding. And I would go down to the emergency department and talk to the person and see if they wanted to join the the community health worker program at BMC. And that's what I did for until I graduated, because I did my master's part-time. Of course, and I would suggest everyone do this, unless you're like super rich and don't care about money and all those things, and you can get a job at your dad's nonprofit or whatever. I'm not talking about y'all. I'm talking about people that are actually trying to do the work and don't really have as much opportunities that other folks do. I would suggest do the master's part-time, because you are already working in the field that you are going to get a better amount of money, a higher amount of money once you complete the master's, right? And at that time when I started, as I was mentioning to you, I was still dealing with a lot of things, and my imposter syndrome was still very prominent in my kind of persona, and that stopped me actually from going into an epidemiology statistics certificate in my master's. I decided to do CAPD, so technically community health sciences. So community development, implementation, evaluation, because I was already doing that in my 40-hour-a-week workday. I was already doing community health sciences at work. And I felt like, yes, I got the terms to go together with what I was doing during the day. But I would have preferred, if I did it over, I would have done epi and statistics. I was just scared. I still, to this day, have financial trauma. And every time I see numbers, I immediately sweat. Like, I can't do it, and that also is part of, our community. It's strategically planned that way, that our communities are not financially literate, are scared of numbers in general, are not as good in math and science, as our white counterparts. And that really did stop me from getting that certificate. But, I did my master's. I went, I finished it. I was able to find, Black and brown women in that program that till this day we support each other, right? And I joined the board of Students of Color for Public Health there. We did a couple of events every year. We started the first Boston School of Public Health Students of Color graduation ceremony that year. And I was still trying to do community things. while I was working and also school, because I've always just been a community person doing community work for my community. And they taught me a lot. And, I was still dealing with a lot of stuff at the end of it. My imposter syndrome was so bad, actually. When one of the last graduation requirements that I had to do was an individual learning experience. So every certificate has this sort of big thing that you have to complete. For like law and policy people, it's like write a argument or whatever. For community health sciences, it was write a grant, right? We all have to write a grant, know about grants. And so I wrote it last minute, and I definitely didn't do as well as I could, and I didn't get a passing grade. So this is the summer of 2019. So with my imposter syndrome, I did not complete it. So, and again, this was also, oh God, 2 weeks before I was supposed to leave for the Peace Corps. So I did not complete my ILE, meaning that I didn't officially graduate from the BU School of Public Health. So even though I told everybody that I graduated, I actually didn't. I unofficially graduated because I completed everything. I completed all the courses and all the things. But my imposter syndrome and my kind of trauma with, from my youth and my childhood, I could not finish this report in the 2 weeks that I had to go to the Peace Corps. And just so you know, everybody, I officially graduated. Nobody, don't worry, I finished that paper, but it was 2 years later in 2021. The summer of 2021, September of 2021 is my official graduation date with my master's, even though I unofficially graduated in summer 2019. So yeah. And I say that now proudly because I was very, very, very ashamed of this. Again, I was lying to everyone and nobody knew what was happening internally. And that's kind of why I'm saying it, and also why I try to tell people to be true to yourself, because again, you are not the only one. You are not the only one, and you could always help someone, and it's nothing to be ashamed of. It's nothing to be ashamed of. And we all have our journeys. It's not a straight line. It's a squiggly line. And I just think people just need to also lessen the pressure on themselves, but also strive for what you want, right? Kind of like the balance of lazy and high strung, right? Be in the middle. So I say all that to say that I think it's important to note that, because I want people to understand that there's just different tracks for folks.
Yeah, give yourself grace. That is very, very important, because a lot happens in life, but I think like also to your point is that know what you want and try to go over that, but give yourself grace along that path, because things come up and life comes up and mental blocks and whatnot come up. So that is absolutely fine. And I also like the point, or like just a perspective that people could think about when thinking about getting into the master's program, is that do it part-time, because as you do come out, you are coming into the workforce with that experience, with a salary already that and then it makes it more competitive for you to get a higher salary going forward.
Mm-hmm. Mm-hmm.
And so tell us about that transition into the community health specialist in the Peace Corps, because if I'm remembering this correctly, you went to Cameroon and they worked there, and this. So and I want to kind of understand like your thought, your mindset as well going into this, because you said you didn't graduate, but you're telling everyone you're graduating. Then you go into the Peace Corps 2 weeks later. So like, how are you dealing with that? How, like, what kind of work did you do, and like, how did that all affect you?
Yeah. So again, I thought I was going to graduate right when I submitted the application. So for folks that don't know about like the application process for the Peace Corps, we were the guinea pigs when I applied, which was, I believe, 6 or 8 months before that September of 2019 when we left. that was the first time that the application of Peace Corps had changed. So before, it was just a general application and you would wait for, I don't know, 6 months to 3 years. It was very it was not, there was no due date. Like there wasn't, you'll know by this day and this, no. people would apply and then like a year later when they completely changed their life, they'd be like, hey, are you still interested in the Peace Corps? We would be like, no or yes. Right. This was the first iteration of this application. So you had the exact date that it was due. Your application was due, the exact date that you would leave, the exact day you would come back, when they would let you know everything. So, that group of people was the first iteration of this application, which is ironic because then Peace Corps, COVID happened and it was like, we did this work for nothing anyways. So yeah, again, I put, prospective graduate of MPH for, summer of 2021. Technically, I wasn't lying. I thought I was going to graduate. But again, at that point, I already got in when I got the announcement that I was going to get in. Of course, I was so excited. I wanted to join the Peace Corps. I would say I was a hypocrite in this aspect because as someone that doesn't really, believe in capitalism and kind of believed in the system that we kind of fall under in this country, I was literally going to work for the U.S. as a Peace Corps volunteer. So I was technically being a hypocrite. Actually, no, not technically. I was being a hypocrite. But this was my first, again, I'm global health, right? This would have been my first global health, very, all-encompassing experience. And this was going to lead my life into global health fandom, I guess, right? Because Peace Corps, I still say this, is if you're a Peace Corps volunteer, you're guaranteed pretty much any job, public health job, with, some other things that might be in your resume. But, when I got in, because I had applied when I got back from the Dominican Republic. And that was 2014, 15, and I didn't get in. I didn't pass the first round. This time I did. So again, it's a sign I'm going to the Peace Corps. This is great. And I had just gotten back from Mexico actually, because one of my global health courses, my last class for my master's was a global health course that was not only my practicum, but a course. So I was there for 5 weeks, and that also gave me some international work experience. I got we got on our car, my mom, my stepdad, my brother, and I, to Philly, because that was the airport that we were going to start our journey to Cameroon. And I met all the Peace Corps volunteers that were going to Cameroon, that cohort. And I was like, okay, I'm going to stay in my room because I have something to do. I was going to finish the paper that night. Didn't happen. It didn't happen. To your point, my mind was blocked. I was getting nervous. All the imposter syndrome, I just didn't do it. And I was just like, you know what? It's okay. I'll just do it when I come back in 3 years. Because again, at this time, I was already in the Peace Corps. I was going to be there for 3 years. I'm like, why did I care if I finished this paper or not? And in my head, I was like, we have, a month of training. I'll finish it. I'll do it slowly in a month, and then of course that didn't happen. But yeah, it was amazing. Again, it was like, oh my God, this is gonna jumpstart my global health career. I'm a community health specialist. I already know what I'm doing. It was amazing. It was amazing. So I was excited to go and spend 3 years in Cameroon.
And what type of work did you support while you were there?
So Peace Corps will forever and probably always have three sectors: malaria, HIV and AIDS, and maternal and child health. And no matter what sector you choose, whether it's economic, health, teaching, agriculture, you kind of still have to revolve your work around malaria, HIV and AIDS, and maternal and child health. I, of course, was a community health specialist. What else was I going to be? So you just had to pretty much be a community health person working on all these different aspects, which I already did. I already had experience with. It was really just a matter of doing it in Cameroon, in this particular village that you were placed into, with the challenges and barriers and the different system that you have in said country. My country was Cameroon. So that's what I did.
Thank you. I don't think I feel like a decent one, I guess, in the Peace Corps that come on the podcast, but none of them explain that the Peace Corps works specifically in like malaria, HIV, AIDS, and maternal health. So I appreciate you sharing that and information for those of you that might be thinking about joining the Peace Corps. I think that's awesome that you also say that like you already have done this work. It's just like I'm being transplanted into a new community and trying to figure out how to do it in this context.
Exactly. Transplanted. Perfect word.
Right. Okay. So 3 years pass, you come back to the US, you get a job as an infectious disease contract manager at Massachusetts Department of Public Health, as well as completing that paper that you have for your MPH program. How do you come across this job? What do you do? Tell me that process there.
Omari, but you're forgetting a big thing. COVID.
Oh, right.
COVID happened. I wasn't in Cameroon for 3 years.
Right.
If I was, I would have just gotten back. I would have just gotten back last September of 2022 if COVID didn't happen. But COVID did happen, and it happened so we went to Cameroon September 19th, 2019. We left country March 18th of 2020. So we left on our 6-month anniversary of being in Cameroon.
What a way to celebrate.
Yeah, I can do a whole podcast on the evacuation process. But let's just say that we all evacuated, returned Peace Corps volunteers have our own trauma in relation to the evacuation. And my therapist, who was my therapist, said it nicely. We will always grieve the life that could have been. I will forever grieve the life that could have been, because obviously this was my chance. I sold everything. I gave away all my books. I gave away all my clothes, my car. I didn't expect to live in the United States ever again. I was just going to come here to visit family, and that's it. So, of course, I have just another piece of trauma because I came back to this place that I didn't even really care for. And, of course, I was depressed for a couple of months, but I'm in public health. I started getting that inkling. I was like, I have to do something. It's COVID. This is a public health emergency. And what better way what better way to help than to actually be part of the department that is dealing with COVID for the State Department. So to your point, that's when I got the job as an infectious disease contract manager for the Office of HIV and AIDS, which is in the Bureau of Infectious Disease and Laboratory Sciences. So it was literally the bureau that was giving all this COVID money to all these organizations. Besides still continuing the HIV and AIDS work that we were doing and the substance use things that we were doing. So it was a lot. It was a lot. That's how I got the job. Not sure if you want me to talk about kind of what that job entails.
Yeah, please do.
Yeah. So I was an infectious disease contract manager, and it's essentially just advising the number of contracts. So again, this is also one of the things that I realized too. The system makes all these large words to try to sound complicated and important. But you're pretty much just advising, the people that you give this money to on how to best use this money effectively. That's really what it is. Contract is such an elitist word, right? There's just so many barriers for us to get into these systems. And that's one of them, word choice and language, which is why, a lot of people in public health work on language accessibility. That's important. So I had about 7 contracts. So again, not contracts, just programs and or entities that get money for, from the Office of HIV and AIDS. And the populations that we kind of serve in the Office of HIV and AIDS, again, in the Massachusetts Department of Public Health, are folks that have HIV and AIDS, people who use drugs, transgender individuals, non-U.S. born, and people of Puerto Rican descent. So those are the 5 populations, and they're kind of for, again, this is specific to Massachusetts. Departments have different kind of outlines. Different state departments have different outlines. So we could fund 4 things. Let me see if I can remember them. Obviously, HIV testing and linkage to care. Miscellaneous, which is the last one. And so people got to make their special programs, which is my favorite. OEND, huh? No, I remember though. I remember. Okay. I kind of do it in my current job too. OEND took me forever to learn these acronyms. It's, again, part of public health too in medicine. It just takes time. OEMD, which is overdose education and naloxone distribution. So again, this is not particular to a lot of other states, because a lot of other states don't do syringe service programs.
Correct.
Massachusetts does. So we fund syringe service programs and overdose education and naloxone distribution. Some states don't even distribute naloxone, which is the reverse drug of an opioid overdose. Right. And then we had the 4th section that Office of HIV and AIDS funds is just kind of care management programs, technically what I did for GRI. So those are the 4 sections I worked in, and I had 7 contracts throughout my year and 8 months that I worked there. And it was a great job. Again, you have to work in these different sectors. There's a lot of different sectors for health, medicine, or public health. State or federal is, a good one to have, because you learn about bureaucracy, you learn about how to deal with different, groups that are doing this whatever public health intervention. We gave OHA, Office of HIV and AIDS, or any state department gives money to nonprofits, to hospitals, to clinics, to bigger nonprofits, smaller nonprofits, and you're dealing with all these different entities at once and trying to advise them in whatever capacity you can based on what they can do, right? And, we did monthly calls to check in. We showed them their data using dashboards, which is, epi and stats. And when I did that, I was like, oh, this is what epi and stats is? I could have done this, right? So that's when I was like, it was just imposter syndrome that stopped me from doing that, because it was easy. I was just like, oh, this is what you did. And again, I took advantage of every opportunity. I took meetings with the epidemiologist. I took meetings with the stats person to see what they did and what programs they used, to take advantage of everything that you can to help you get to where you see yourself in 3 to 5 years. I knew that I needed work on grant writing, on statistical analysis, and budgets. Again, still the financial trauma. I was hitting the budgets after 6 months so fast, right? And I was like, oh, this isn't bad. This isn't bad. And it was just great. I took advantage and, joined being a COVID ambassador. and our governor of state at the time, Governor Baker, he acknowledged all the COVID ambassadors, right? Because we were people from the community that were doing certain meetings with vulnerable populations on how to make it better. I knew that I wanted to help my community, so I made sure I got involved in that. I was on like interview boards, right, on how to on interviewing new staff for different departments. And then what's really important to me always is making sure that everything is equitable. So I made sure that when they said, hey, do you want to be on the grant review board? I said yes, because historically, and the stats have shown that, Black organizations and companies and entities that are run by non-white individuals or have majority non-white individual staff, they don't get the money. They don't get the money that they deserve. So I was like, okay, so I'm going to be part of these grant review boards to see how people are, taking points down on all these grants. And, ultimately I found out, I was like, just like the stats say, they brought them down because there was typos, or they should have done this, they should have done that. And, and I said my piece in all these meetings. I was like, here are the stats. Should we really be putting a number down because of this? Or historically, do you know that this organization does that or does not have the capacity to do this? Should we? Right. So again, bureaucracy, knowing how they do it in the states and the feds, because this is exactly what they do in other state departments and fed departments. Look at all these different things. It's very elitist. It's still very elitist. It's still, we're still working on this white supremacist world. You have to be able to say your piece in those rooms if you feel safe to do so. And if you don't feel safe to do so, I would suggest finding a place where you do. Because I wouldn't be able to be in a place that wouldn't allow me to say my piece. So it was definitely a good opportunity.
Yeah, I can only imagine the opportunity that arose from the pandemic and just being able to support that kind of work. And I think I want to highlight some things that you did mention there is the EPI and stats that you did in this role made you realize that the EPI certificate that you could have gone to the Masters of Public Health was just a limiting belief in yourself that you couldn't do it, because realizing that you could do it, as well as the budget parts and saying that you have this trauma with money and finances and with budgets, and then just being in that space and continually showing up and doing it helped you to write a new narrative for yourself around this thing and be able to show that you are able to be proficient in this and share about that. So I appreciate you sharing that.
Of course.
A lot. Yeah, and before I get into your current position, I wanted to ask, because you've spoken a lot about mental health and trauma, stemming back all the way from, well, I guess just growing up as someone who you are, but stemming back from your days in the predominantly white institution in undergrad, and then all the different series of things that happen. And I know trauma looks different for a lot of different people, but maybe there were things that you have learned throughout your process that was able to save you in overcoming or working through these things.
Yeah. So I definitely found my vice when I found kickboxing in the beginning of 2019, I believe. So that's my thing, kickboxing. But I fell back in love with reading again, and that's my first love, actually. My first love is reading. My second love is public health / global health. So definitely reading. And then again, I actually got a therapist for the first time when I came back from the Peace Corps. So I think actually when I started 6 months into starting the job at DPH, that's when I got my therapist. And again, being very intentional about who my chosen family was. So, this all revolves around just growing up and trauma and all that stuff, but I didn't have a lot of people to talk to. I didn't have anybody in my family that could relate to anything that I was saying. So when I found a lot of my chosen family in my master's program, I knew that that was super important. So I was very intentional about finding the same, people to guide me or to help me on this journey, that were also finding people that could also help them on their journey, especially around breaking generational curses. Statistics have shown that millennials are really trying really hard to break generational curses. A lot of us go to therapy. A lot of us talk about therapy. The reason why people feel comfortable saying I go to therapy is because of millennials. And I try to find those people in my life, especially that were having conversations about spirituality and the power of ancestry and the power of self-love, self-reflection, all of that, and then keeping them in my circle and leaving everybody else out, or not even entertaining other people. And so this day, that has worked wonders. There's certain things that I can do with like family and like certain like kind of arm length acquaintances, but I know who my chosen family are. And, along with therapy and kickboxing and reading and making sure I take those unplugging weekends or unplugging trips where I just don't do anything for 2 to 3 days is super, super essential. And recognizing that, as Black women, it's the stereotype that we have to do everything and some more. And after a while, I realized that no, that's not going to be me. I thought that it was just that I could change the world by myself. That's what society says that is the what Black women should do. And I knew that that wasn't going to be where I wanted to see myself. And so it really has led me here where, I'm able to say no, right? I'm able to say, let me mark off a month or a weekend every month where I'm not doing anything. And also just giving myself grace, right? Giving myself grace if I don't go to kickboxing for whatever amount of time. Because we have things that, happen. I sprained my ankle in the beginning of was it last year? Honestly, I don't even know. I don't even remember.
What's time?
I even think it was last year. I don't even know. But then it took a while for me to even go to physical therapy. And then when I got to physical therapy, after a while, I was like, oh crap, the insurance is not covering the most of it. So I'm like, crap, now I have to pay this bill. There's just so many barriers, right? And being okay, giving myself grace with the fact that I didn't know that now I have to pay this additional amount that I didn't know I had to. Because things happen and you can't turn back time. And then I recently hurt my back. So I'm like, now I can't go to physical therapy. I can't go to kickboxing, right? And being okay with that, right? But also acknowledging that, it's going to pass. It's going to pass. And there's other things to look forward to. So I say all that to say the mental health, the self-care, the work, the work and the community work should all be something that you're thinking about all the time, but making sure that at the beginning of that is also always to take care of yourself. Because if you can't do the work if you don't take care of yourself.
Just being intentional and taking care of yourself. I like that. And you gave a lot of different tools. Some things that I wrote down that I think will highlight is like therapy, having a community or chosen family, being able to unplug, being able to find activities that filled you up, understanding that there are seasons in life and to give yourself grace during those periods, and then understand that just things happen. So yeah, I really, really appreciate you sharing that and being vulnerable throughout the entire episode about that in your life. So thank you, Darian. Okay, so moving on to your current, you're welcome. Moving on to your current position. You're a senior manager for substance use and recovery initiatives at Massachusetts League of Community Health Centers. How did you come across this and what do you do in this role?
Yeah, so after a while, I actually was getting kind of bored and complacent in in the state job. Again, that's not to say that it was a bad job or, you know, something negative happened. I just realized I was like, oh, I can do this. And I was like that for a few months, for 3 or 4 months. And, you know, and then so I started to look at other, you know, higher opportunities at the state. But, you know, what a lot of people don't tell you is the state is a state job that's paid by your tax money. And those positions are kind of, the salaries are already kind of outlined.
Right.
And I applied to be a manager or a position that would work with equity in COVID. And even again, people just help you. And when I got the first call of the interview, I straight up asked them, I was like, are they going to give me what I want? And she straight up said no. And I was like, well, thank you for telling me that, because she was a sister, and she said they're not going to give you. And unfortunately, we lose state. You know, she said that, you know, the state loses a lot of really good candidates because of the salary situation. Right. And that makes it also inequitable, right? Because usually, who are the folks that need higher salaries? Us, because we need a higher salary. So I was like, well, that's my side. Unfortunately, I wasn't going to stay with the state. Not that I can't come back. A lot of people actually do come back to work for the state. And then at that time, Paul Farmer had passed, and I was like, okay, that's a sign. That's a sign that I need to go back to global health. And when I talked to my mentor, she said, the global health field is kind of rocky now because of his passing. Why don't you give a job here a chance for a few years? So the first job that I saw when she told me that, and I put Boston instead of global on LinkedIn, was this job. Originally, it was for a director of substance use and recovery initiatives at Mass League. But when I did the interview, again, getting in my head at that time, right, my imposter syndrome, like, it was bad. So I was like, okay, chosen family. I had like 2 or 3 people do mock interviews with me. I called everyone in my books, right? Asked them all the questions. What should I do? How should I? All the things. And they gave me the great advice that they always do. And, you know, when when my supervisor gave me the "you got this job" call, and I think I mentioned this because I think this is very important too. There is, as in every sector, just a way that things happen. That's just how it is. So for this particular instance, it wasn't a direct. They had changed. They gave me the option. They gave me the position, but said that it was a senior manager. They brought it down from director to senior manager, and they told me that, you know, looking at the years that everybody else in the company, you know, had when, you know, as the senior manager, the manager, the director, I was nowhere there. Because to be quite honest, I never managed a program. I was a contract manager, but I didn't make the contract that we ultimately, you know, that the people that I advised at the state chose to do. I didn't make that contract. So I've never done this particular, I never managed a project. So that I understood, because I can't change that. That was going to be the instance for literally anybody who applied for this position. And what I was very happy to hear, though, was because this position was up for 6 months before I saw it, 5 or 6 months, and they pretty much stopped the hiring process to hire me, to interview me, and then ultimately hire me, even over people that had a lot of years of managerial experience and supervisory experience that I did not have. And they said that they wanted someone that was community-based, that could actually connect to the people that were actually doing the work in the community that could grow in the position and that really had a passion for the work. And that's literally everything that you just heard that I had in the last hour. Right. So they offered me the job and just said that it would be a senior manager, not a manager, and not a director. And I actually understood it, because even if I was in their position, I would think the same thing. I would say, okay, so I've done work for 15, 20 years. I'm the director, or I'm the senior director, or whatever position this person, I get it. I started to say, I get it. But that does not mean that you should not advocate for yourself. In the beginning of when you get a job offer, and as you continue on in this position, because I fought for a higher salary, and my supervisor even then was super great, and he fought with me and I got it. And even when I'm doing this job now, again, thinking about the future, okay, so how can I get to that position now? Now that you know that I can do it, again, I'm sure that they didn't think I could do it. I just think it just in terms of fairness for the other staff, and then me coming in, I get it. But now I'm like, okay, so how do I get that extra, right? Right. Even though it comes with more responsibility. I've been in this position almost a year. So I'm like, okay, so how do I, right? It's all about professional development. So currently, so that's what I did, and I accepted. Currently, so that's my title, senior manager. But what I really do predominantly is manage a specific contract called the Mass General Brigham Substance Use Disorder Equity Grant. And the Mass League is an organization, or is a primary care association that advocates for health centers, and all health centers, or most health centers in Massachusetts. And we are part of the clinical team. And in the clinical team, there's a substance use team. And this particular grant is around substance use, and is to, the goal of this grant is to improve, increase, enhance substance use services at the health centers that we're going to choose to get the funding, specifically for the Black, African American, Hispanic, Latina, and Native and Indigenous populations. Because we are suffering the most with the overdose rates, but we are not accessing the services in the same amount that we would think compared to our white counterparts, based on the overdose rates that we have. And so with that, at first, the first few months, I did a community needs assessment, which is something that many folks will be familiar with, since you kind of learn about it in some sort of in public health education, to see what the community says and what the health center says in regards to this inequity of services. And then we'll release the fundings to certain health centers for a amount of time. So that's what I do at Mass League. And that encompasses a lot of stuff as well. But yeah, that's essentially what I do.
Okay, I appreciate you sharing like that overview of you coming in for the director role, and then senior manager, and like the fairness as well as the advocacy that you do for the role that you want, as well as you're getting into this role, ensuring that you know what are the things you need to do in order to get to that next role, and ensuring that you are like hitting those metrics that they want you to hit as a senior manager, so that you can advocate and say, hey, I've done this, now let me see like what this next stage has in store for you. And I guess that kind of leads into the next question. Where would you like to see yourself in the future? If not like just global health, I'm guessing. Or maybe I'm speaking that into your brain right now.
Yeah, well, this is my baby. So this particular way of doing this particular work for health centers is the first of its kind. So I'm not leaving this position, and this is a 5-year grant. So I'm going to be in Boston for at least another few years. But yes, my plan is to eventually go to global health again. If not directly after this role, then a little bit after. But I also just want to grow in Boston as a public health professional. I do my work, but again, public health is health and community. So I do community work, whether it is, the mentorship that I'm doing or connecting the community organization, the community coalitions and groups together to de-silo kind of the way the Boston organization groups have been forever, strategically so. Right? Because a lot of, the powers that be, they say, there's no money when there's money. That you're just not prioritizing our communities. And so that ensue creates the crabs in a barrel response. And so then, we're fighting amongst each other and then there's grudges, right? And things like that. So trying to kind of de-silo Boston with all the changes that's happening here. I mean, we have a new government, right? All of our kind of main, we have a female governor and now we have a female mayor. And now it's just a lot of things are changing. And I'm also trying to make sure I don't get overwhelmed, because if I'm overwhelmed, that means that the community is overwhelmed, right? Even more so. So how do I help with that? There's just a lot of different aspects to it, youth violence, food insecurity, so there's a lot of little things that I'm doing here and there, and then networking with people so that they can do the same work and know people to make sure that we're also not double dipping, right? Especially around, community violence, community activism, civic engagement, substance use, community health work. Where are we not hitting, right? Where are we not hitting? Let's work together instead of putting everything in one area and there's just then there's that pot of money is in that area. No, let's have one person do that then so that other money can go somewhere else, right? And then, just trying to dip my toes into other stuff, whether it is joining a committee for Boston or or maybe teaching in the future. I don't know. But yeah, let's see what happens. Let's see what happens in 3 or 4 years that I'm still here in Boston. And then I'll come back to you, Omari, in like 4 or 5 years.
That absolutely makes sense. And I love it. I love just like you saying, okay, let me do this global health work. And then your mentor saying global health is in a kind of place right now. Let's focus on something local, and then you get in this position and then realizing it's something that you enjoy as well as you're learning from and you can develop into. So I love that. And I think that's a point to say to anyone out there. Don't have a fixed mindset on what is possible out there, because you never know what opportunity you fall into is something that you would love or feel passionate about, or something that you think you want to grow more into. So I appreciate you sharing that.
Of course.
And then moving on to the Furious Five, we'll ask the 5 questions I ask all guests. Okay. Number 1, what advice would you give to a student trying to pursue a career in public health?
Oh God, Furious 5. Okay. I said in the beginning, be yourself. Do not change. If you have a certain personality that's off-putting to a lot of people, don't worry, because as it has helped me, it will help you. And you just have to be very true to that. And, as Omari said, also, you can change what you want to do and how you want to do it. Don't be stuck on the process, because clearly COVID messed that up for me. And it was okay. And I'm still doing great. And if you're already in this place where you want to think about your master's, try to do a part-time and do the work. And even if it's at a place where doesn't necessarily connect to public health, but as we said, public health is everything. I would really consider doing your master's part-time, because it will go by so fast. It really will. And there'll always be people to support you in that.
Love it. Love it. Number 2, If you're talking to someone wanting to get into your position, what advice would you give them?
Stick to your community. They will be your supporters when your job will not. And your job is just your job. You will be living in your community for however long you want to. And they will also be something that you fall back on. You do not have to be the center of attention. You do not have to be the one that's saying everything all the time. You do not need to educate white folks in the work. They should already know. But I say that to say that it's also okay to ruffle some feathers when it comes to what is actually right and should be and should be the driving mission of health equity. If that's not something that's prioritized in the place that you work, then maybe thinking about finding another position. And if you feel safe, advocate for that in your place of employment.
Love it. And number 3, what's something you're working on improving in your life right now?
Yeah, so I recently took all the social media apps off my phone because I realized that it was affecting my mental health negatively. And with that, I sent all my chosen family and even like further acquaintances personal messages because I realized that I was lying to myself. We're lying to ourselves when we say, oh, I connected with them. No, we really just commented on their story or liked their picture. And because I'm a community person and a people person, I found that I was actually not being true to who I am. And I'm happy to say that in March, that this is my January, I took it off took them off on Christmas, that I've had less almost anxiety attacks. And I've seen a lot of people that I haven't seen since COVID. So I'm making sure that I prioritize in-person conversations and experiences.
That's real. And I think like just being self-aware about that is important for people to understand. So appreciate you sharing that.
Yes.
Number 4, professionally, do you recommend anything?
Yeah, so I wrote down a couple of things, but I will just say that being in community is health, is public health. If you're doing public health work during your 9 to 5 and you're not doing any community work or community anything during the weekends or in the afternoon, then you're not really doing public health. And I find that a lot of places that I'm a part of, even sometimes at work, if you don't know your community, then how are you doing public health for the people that you said that you want to help? So I will recommend just going to community events, block parties, open mics, whatever. Just be in community and talk to people. Don't just stick with your kind of the people that you know and family. There's other people out there doing the work. And in terms of books, I will suggest Medical Apartheid by Harriet A. Washington. A recent novel that I fortunate enough to know the author, and one of my friends was a contributing person that was highlighted in the book. You Are Not Alone by Dr. Ken Duckworth, which is a story that for the first time, folks that experience mental health, folks that have mental health and substance use disorder, actually tell their stories. Because if you know historically, and doctors' books or journals, they don't identify the people that they're talking about. But this book was super intentional about including people's stories, emphasizing that recovery coaches and community health workers and people that are working in the field that also experience that same thing. So the peer model is actually where we should be working on. Again, connected to the community work, that community-centered stuff that I was working on, that I was talking about. So the book is called You Are Not Alone by Dr. Ken Duckworth. And then just recognizing that we didn't get here just by, to use Omari's term, transplant. No, there is history that we have in this country, in this world, and I think that it's important to think of that when you're doing your work. So I think a good book of that is The Way the Word is Passed by Clint Smith III. And there's just so much history. I mean, you can read The New Jim Crow. You can read The Warmth of Other Suns. Just the historical context of how the life has been for the most oppressed societies, oppressed groups in this nation, but also globally. And the podcast, I think I shared it with the Discord. I think it's called Wealth, Power, and Health or something. Let me see. I just want to. Do you remember what it's called? Money, Power, Health, or something.
I will find it. I'll put it in the
yeah.
in the show notes for everyone to check out.
It's so good. It talks about not the social determinants of health, but the structural determinants of health and the commercial determinants of health. We're finally talking about how money contributes and negatively impacts us in public health. And I know some people are mad, but I'm just so excited that there's, somebody that's talking about it and did a podcast, but it's real. So yeah.
Okay, that's awesome. Thank you so much. And I'll be sure to share all of those in the show notes. And I think that commercial determinants of health is something new that's come up for me. I think I recently saw a framework someone posted on LinkedIn. I'll definitely share or talk more about that, just generally speaking, because I think it's important that we highlight these new way of thinking. Definitely enjoyed the way the word is passed. I think is a great book just to understand like narratives and how history and the narratives that are parts of history and how they are formed, and understanding that there's so much history, and it's hard for us to like actually understand what were all the perspectives in the history that actually happened and how that affects us. I think great book. And also just like to highlight the You Are Not Alone book, novel. Never read it, never heard of it, but I think it's important, as you said, like just having that narrative be told by the people that are in these situations, because so many times it is told by someone else that doesn't acknowledge their story and their humanity. So appreciate you highlighting that. So you'll definitely check that out. And last but not least, where can people connect with you, Darian?
Yeah, feel free to connect with me on LinkedIn. I'm sure Omari will also share that. Darian Leta, Darian, Leta, Leta. And then I also have an Instagram, but again, I'm trying to not be on it, but you can still follow me if I ever intend to go back. It's DLETA14, DLETA14. And yeah, again, I'm really about having these conversations and helping folks and connecting to people. So please email me. You can share my email, Omari, to let.darian@gmail.com. I'm here for conversations. I'm here to just connect with folks that are doing similar work. And yeah, I'm just excited to connect with folks. So excited to do that if possible.
Absolutely. Thank you for sharing that. And if any of Darian's story resonates with you, be sure to reach out, make that connection, build your network, learn, share, and grow from there. But thank you so much, Darian, for coming on and sharing your story. Greatly appreciate it. Greatly appreciate your perspectives.
Thank you so much.
Yeah, my pleasure. Housekeeping items, everyone. Thanks for watching or listening to this. Be sure to subscribe if you've not subscribed as yet. Leave a like if you're watching this on YouTube. Leave a 5-star review if you're listening to this on any podcast platform. And be sure to share with a friend. It really helps the show get out to more people. See you all next week. Peace.